Congresswoman. How are
Good
you?
evening. I'm good. How are you?
I am very good. Um, yeah, aside from the disaster of the markups we're seeing today, but it's still beautiful here.
Yeah.
Um, so
There's
thank
so
you
there's
so
that.
much. Aside from the disaster in DC, doing great. Really great to have you. I'm just going to ask, it's Mondays with Maxine. We've been doing these. I know you've been doing some amazing social media outreach, so really grateful to have you. We have a really important conversation tonight talking about this Medicaid attack that has been denied for months by our Republican colleagues that we were fear mongering, and here it is. Like they are going to get Medicaid if they get their way. So I'm going to let you introduce yourself and we'll get going. Thanks so much for being here.
Sounds good. Well, I'm so happy to join you, my new doc friend in Congress. My name's Kelly Morrison. I'm an OBGYN by training, actually. I had the privilege of taking care of Minnesotans for more than 20 years. And when I was elected to Congress last fall, I am the first and only pro-choice OBGYN ever elected to Congress, oddly enough, because there have been a fair number of OBGYNs. But when Representative Dexter and I and Representative Conaway were elected this fall, we now had a critical mass of Democratic doctors. So now there are six of us. I always say it sounds like the beginning of a joke. You got a pulmonary critical care doc from Oregon, an internist from New Jersey, and an OBGYN from Minnesota walking to a bar. But so there are now six. So we had a critical mass. So we formed the first ever Democratic Doctors Caucus. And I think we're really gelling. And I think we can have an important role during these really challenging times. One of the first things we did was to hold a press conference to explain our opposition to the nomination of RFK Jr. to be Secretary of HHS. We've all been leaning in really hard and ringing the alarm bells about these proposed cuts to Medicaid. I think we all feel like it's our absolute obligation as physicians to explain why this is going to be so devastating to our country if they actually go through with this. So I'm really, this is really fun. I love that you're doing this, and I'm very honored to be invited tonight. Thanks, Maxine.
Yeah, it's great to have you. So I'm going to ask folks who are joining to drop in the chat where you're from. Kelly's from Minnesota. I'm from Oregon, and we have folks already here from Oklahoma and other parts of the country. So really great for people to join. I just want to say that we're going to really focus on the Medicaid aspect of the Energy and Commerce Committee markup or the budget reconciliation bill that has been proposed is going to be marked up tomorrow. And what that means is the committee is going to be looking through each of the proposals and offering amendments, talking about it, and then whatever emerges from the committee may not be tomorrow, it may take longer than that, will be what we vote on the floor. There are more steps before it becomes law. The Senate needs to, that was my son in the background, the Senate needs to go through their process, and then we will do a final vote if it gets changed as it almost certainly will. So healthcare is a human right, full stop. I think all of the all of the Democratic docs in our doc caucus believe that. Preventative health is the foundation for everyone having long-term health. So really grateful to Kelly joining us, and I would love for folks to also drop in the chat. Um, my son had something he wanted to share with me. Drop in the chat if you've been able to get an appointment for just a preventative care appointment in the last year. Just share with us if you're having an easy time, you've got great access, or if it's really been a struggle. I know that varies depending on where you come from. So our, goal to have healthcare be a right for everyone has been under attack, and it's especially under attack now. The Republicans dropped their markup or their reconciliation bill for this committee in the dark of night last night. So we all woke up to it this morning. And they are gutting Medicaid so that they can give billions or trillions of dollars of tax deductions to billionaires.
I
This
think
is
that's so
not
important to level set there too, because I feel like we have these conversations, we have these debates, and we talk about why Medicaid is so important. And then you sort of have to go back to, wait, why are we
Why?
doing this again? And the whole reason we're even having this conversation is so that they can make the math work to do tax cuts for the wealthiest among us. It's kind of mind-boggling. I mean, it's horrifying. And just a quick level set
Please.
about Medicaid, because it is called different things in different states. In Minnesota, we call it medical assistance. So I think sometimes people don't
Yep.
even really know where their health insurance comes from, but it covers almost 80 million Americans. And it particularly impacts children, pregnant people, people living with disabilities, and our elders in long term care. So in Minnesota, for example, it covers 33% of all births. Across the country, it covers 40% of all births. And I find that particularly ironic in this moment when we have this administration making all this big deal about how they want to pressure women to have more babies, offering medals for having more than 6 kids, saying, hey, we'll write you a check for $5,000 per delivery, which, by the way, doesn't even get you out of the hospital. And also, we're going to get government involved in tracking your ovulation. Like the whole thing is super creepy. And they're saying all this while they're making it harder for people to have kids and raise them in a thriving community. And then layered on top of gutting Medicaid, they're also adding these tariffs onto the cost of baby gear. You can tell I'm kind of passionate about maternal and infant health and OBGYN. I can't help it. But you know what? That's our future, right? Our
Yep.
youngest Americans, that is the future. And for them to get off the best possible start, they and their moms need to have access to health care. It's very simple.
Yeah, it's simple, but they are absolutely trying to stabilize the
Yeah.
whole system. And in
Yes.
Oregon, our rural hospitals are really going to suffer with this bill,
Same thing in Minnesota. Same thing.
which is
Across the country.
also
Yeah.
which is also ironic because it is more likely to be in a Republican district where you find these hospitals, and they are literally voting for their community's poor health outcomes. You have to wonder where their priorities are
You
because it doesn't seem to be with their constituents.
No, for sure not. But I do want to add just a glimmer of hope too, because I have not seen a coalition like the one that has come together across the country who are standing up together to protect Medicaid and saying this is not what we want. And even in Minnesota, more than a dozen state Republican legislators sent a letter to our 4 Republican congressional representatives and the president and said, please do not cut Medicaid. This will
Yeah.
harm our constituents. They understand, they're feeling the pressure because their constituents have been saying, please don't do this. So I read that letter on the House floor. It was actually a great letter. They wrote, it was very well written. It laid out the facts and why this is going to be so bad if they do it. And the Republican caucus has infighting right now. They are really struggling to figure this out. So keeping the pressure on is working. And so I encourage people to continue to speak up, continue to contact your representative, especially if you live in a Republican district.
Yeah.
It's so important that people hear how Americans feel. And overwhelmingly, Americans want to protect access to health care.
Yeah, I mean, at least before democracy was at stake, housing and healthcare were two of the highest priorities in my
Yeah.
district. Similar to what you're articulating, 38% of all residents in my district are on Medicaid. That's over 255,000 people in Oregon's congressional district. 59% of our kids are covered by
Yeah.
Medicaid in my district.
Yeah.
Um, so mental health, maternity care, addiction services and prescriptions, our drug coverage, a lot of this. And I just lost my mom 2 months ago, and she was, so here it's called the Oregon Health Plan. As I know you were saying that some people don't even know what Medicaid is.
Yeah.
In in Washington, it's the Apple Health plan. And my mom was one of those seniors who was living in her home, trying to stay in her home because she couldn't afford to go somewhere where she could get care. And it ended up leading to a premature death for her because she had complications that would have been addressed if she hadn't been so strapped trying to get Medicaid and having too many costs with Medicare even. So,
I'm so sorry,
um,
Maxine. This
yeah.
is personal. Yeah.
No, it is. And this
Yeah.
is like there is somebody in every single one of our families or, extended or immediate families who need Medicaid at some point in their lives. They lose a job or their child gets sick and needs disability services. Like it's a total fraudulent thing to assert that these are folks who are able-bodied and not willing to work so that they can get health care. These are folks who either are in school and are students or are elders and needing, long-term care like my mom or,
Yeah.
disabilities. So many of our disabled community members get the support they need to be able to be productive members of society and be able to function. And it's all due to Medicaid. So,
Absolutely. Absolutely. The other thing about it too is I think, I've spent a lot of time visiting our hospitals and our clinics and meeting with patients and providers and families and hearing from them how these cuts would impact them. And the thing for people to remember is even if you don't get your insurance from Medicaid, these cuts are going to hurt all of us. This is not a Republican or a Democratic issue. This is an everyone issue. Our two main safety net hospitals in the Minneapolis St. Paul metro area have told me very directly that they will likely have to close
yep,
if these cuts go through because the hospital depends on those Medicaid payments. So if
right.
those two main safety net hospitals go, that's one less place where someone can go if they're experiencing a heart attack or if they get in a car accident or they get sick. So this will cause delays in care for all of us, and it will mean less access for all of us. And then, of course, the people who get their coverage directly through Medicaid are going to be harmed the most. This is an all of us issue.
No. Oh, absolutely. And I've heard the same. And even in the urban core, our hospitals are disproportionately taking care of patients who are Medicaid and Medicare over, it's grown. Commercial insurance is a dying entity. And so the ACA expansion that we had in Oregon, did Minnesota expand?
Yeah.
Yes. Okay. So we have broadened coverage. We have the lowest uninsured rates ever, but it's disproportionately government funded insurance,
Yeah.
which is phenomenal that we've been able to do it, but it means that people need to be able to rely on the government to continue funding, or it is just a cliff that literally puts their lives at risk.
Yeah. Yeah. And you think about medical debt that's already such a burden and a problem is going to increase because people are going to delay care because they aren't going to be able to afford it until it's really serious and they're sicker. So preventative care will become a thing of the past for a lot of people, which is so bad.
Yeah.
Exactly the opposite of what we should be doing. Again, all the contradictions, all of this in the context of make America healthy again, none of it makes any sense. There's no coherence to these policy proposals.
No, and it's interesting. There's a couple things I wanted to highlight from from Oregon's perspective in this markup bill that I was looking at. Number one, we will lose 10% of our federal matching rate. So when the state pays, into Medicaid, there's currently a 90% cost sharing that goes to the federal government. And the government is saying if this bill passes, that they will decrease that to 80% for people in Oregon if we are covering people who don't have clear documentation or, if they are undocumented immigrants, and we are covering them, that they will decrease our federal matching rate. And Oregon has very much invested in this. We have been covering many of our undocumented neighbors because everyone should have a right to health care. And it is in the longer term also far less expensive for people to, say someone hasn't had any prenatal care and shows up with a complicated
That's
pregnancy.
right.
That is absolutely going to put, the family at risk, but also the health system is going to have to spend a lot more for their birth than if they had had prenatal care and could identify the problems ahead of time. Does that make sense from your experience, obviously, as an OB-GYN?
Oh my gosh, 100%. We want people to, ideally, people come in before they conceive and plan out their pregnancy. But the sooner, the earlier in the pregnancy that people are able to get care and identify any potential complications and come up with a treatment plan and a plan for how to manage the pregnancy, the healthier and the better the outcome in the long run. The worst thing is to avoid prenatal care until there's a complication or until you're actually going into labor. And thankfully in the United States, we still do accept everyone who shows up at an emergency room and provides care for them. But at that point, if you have no access to care until that moment when you're in crisis, none of it makes any sense, Maxine.
I know. And then there was another provision in there. I think I read it right, Kelly, that if someone has medical debt, that they don't have to be covered by Medicaid until they pay down their debt, which is exactly backwards in my
Yeah,
mind. Like, why would we bankrupt somebody and put them in even worse financial straits if they already are burdened with healthcare expenditures or costs? Um, and then there's also, Oregon has a very focused health system on value-based payment, which means we're trying to pay for people to stay healthy rather than the widgets of, doing some dermatology, burns
yeah.
for skin cancers or other things. Like, we try to incentivize the right care, which is keeping people healthy. And this bill is actually going to do more harm to states that have incentivized value-based payment plans rather than the widget counting fee-for-service plans. So again, it is going counter to investing in people staying healthy and instead is functioning as a disincentive to people getting care. So I would love to hear from folks. We're seeing, I'm just going to go to the live part of this, seeing a lot of folks talking about not being able to get into primary care already and understanding that that's going to get worse if this passes. We've got people from all over the country. I really am excited to see who's joining us. And then what I would also love to ask folks is, if you live in a district that has no matter what our partisanship or our party, if you've reached out to your representative or senators to let them know what your feelings are on Medicaid or what it means to you, I would love to hear if you had a good experience or what your experience was there. Um, and so I'm looking at a couple of these comments that um, about rural hospitals. They have ab absolutely been struggling for years, um, and they're going to be at real risk of closing. And community health centers, also in Oregon, or the federally qualified health centers, those are absolutely dependent on Medicaid, and many of those will close. And that's part of everyone's access to care. And if you close those, it's a funnel effect, more people
Yeah,
trying to get care from fewer places.
that's right. That's right.
Um, so someone is saying DUMS equal Medicaid for all, ours equal cut Medicaid. How can we make that clear to everyone else? Y- I think the foundational question in my mind is just who represents you and what are they voting for? Do they represent your interests? And
Yeah.
if they don't, making sure that they understand why they're not. I think Republicans in general are absolutely advancing a policy that is counter or negatively going to impact their constituents, but I don't believe that Republicans in general want to gut Medicaid. I think this is maybe I'm still an optimist, but I think folks are really in this position where the administration is ramming things down their throats and people are going along with it because they haven't found their courage yet. We only need 4 or 5 Republicans to find their courage. And so I would not give up on them. I would put
Yep.
pressure on them, make sure that they understand what it means to you if you lose Medicaid, if you're on it, or if you need it, what that would mean for you if you couldn't
Yep.
access it. Um, I choose to believe that they want to serve their districts. And so if their districts are reaching out, that soon, I hope, they'll start seeing the light. I don't know, Kelly, am I drinking the Kool-Aid?
No, no, I think that's exactly right. As Senator Hawley just wrote an article in the New York Times today, also making a plea to save Medicaid because he understands. He cited all the statistics in Missouri. He understands what a negative impact it would be on his constituents in his state. And he also accurately pointed out that cutting Medicaid is bad for working people.
Yep.
And he made the case that if the Republican Party is truly the party of working people, as I think some are trying to make the case right now, that they would not even be entertaining the thought of gutting health care for so many hardworking Americans. So I think I agree with you. Courage is contagious. And I don't know if anyone saw Senator Murphy's floor speech a couple of weeks
Oh my
ago. I
gosh.
thought it was so good, talking about the erosion of democracy and how um, democracies don't die dramatically. It's often kind of an erosion. It's rarely sort of the burning of the Reichstag kind of moment. It's a slow erosion. And he said that the three branches of government obviously are a big piece of protecting democracy, but so are four societal institutions, and they're the free press, um, the legal profession, obviously, the business community, and the universities. And they all, elements of each of them have sort of bent a knee to the president at this point, but some of them have started to stand
Yeah.
up. And you'll see, like, I think about the example of Harvard, when Harvard was sort of the first university to say no, that gave other universities courage to stand up too. And that happened with some of the big law firms. It's
Yep.
happening with some elements of the press. So courage is contagious. And so we all need to be engaged and aware. I think it's so important for everyone to recognize who represents them at every level of government. Make sure you know where they stand on the issues. Get involved, support the organizations that support the values that you hold dear, support the independent press, support candidates that you agree with, or consider running for office yourself too. We need good people in all levels of government. And this is, I believe, I'm a half full kind of a person. I'm an optimist, but I believe we are going to survive this moment and we are going to come out stronger on the other side. But it's going to take all of us. It's not going to be easy, but we're going to do it.
No, I absolutely agree with you. And I think part of that is this crisis offers an opportunity for us to rebuild a system that actually serves patients and centers
Yes.
people in it. You and I know that the healthcare system was not created in the United States by people who worked or used it. It was created, by special interests and people who had lobbyists in Washington who could help influence the policy. And if there's ever going to be a time that we need to center people and their voices, it's going to be in the aftermath of all this.
Yeah.
And I know that we are committed to that, and the Doctors Caucus is going to be really helpful guiding that conversation for our colleagues.
Absolutely. Thank you for bringing it back to healthcare.
No, I think that the politics is how all of this sausage gets made, unfortunately, and it's what we're struggling with right now.
Yeah.
Um, so I'm looking at some of the, folks talking about National Health Service and public health policy and talking about RFK Jr. And, I just, the healthcare system is broken, but he is not the person who should be rebuilding it, gutting the research dollars that are happening, making vaccinations, dependent on the parents and whether or not they believe that they're in the right. Like, we need to center public health again, and we are seeing the measles outbreak continue to escalate. Have you had any cases in Minnesota yet?
We have. Yeah.
This is it.
The other thing, I think, you mentioned the research dollars. I think we are really ceding our place as some of the real leaders of the world in terms of the latest medical breakthroughs. We used to be the place that the best and the brightest wanted to come to train and to study and do their research. And now scientists and doctors and nurses are being actively recruited by other countries who are saying, come work and practice and do your research here where we support it. And it's a real tragedy, not only for our country but for the world, because we have developed some incredible innovations in the United States, and to just see that place is it's really hard to understand what the intent is. And the other thing I think we do have to prepare for is some of the damage that RFK Jr. has already done, but is continuing to do. He started this idea that they're going to find the cause of autism by September, which sounds to me like they know the answer that they want to get, and they're going to make some big announcement in September that's not going to be based on good science. And that's going to be really damaging. So we need to kind of keep our eyes and ears open. And I like to think and hope that the Democratic Doctors Caucus will be one of some good resources for good information, and I know we'll be active and working to keep people informed about what's going on. So this is, this is going to be our immediate fight is to protect Medicaid, but we've got bigger battles, and this is a long game that we've got to get through these next 3+
Yeah.
years and come out
No,
on
but
the other
it's
side so we
definitely,
can rebuild.
if we're disincentivizing people going into science and we're disincentivizing people going into healthcare fields, like we are going to have escalating challenges. And so I absolutely agree with you that this is the first fight. We have many more to come. But I am so grateful, Rep Morrison, to be in this fight with you. Like it's been
Back
so
at you.
amazing to like have smart, principled, I'll just call it out, a woman who wants to work together and really build a vision for what we can do together. I think it's really important for people to see that, there's good folks working together from across the country, and there's really a dedicated group of us that have our healthcare hats on. There's other folks with their judiciary hats, Dave Min and Jamie Raskin, and so many folks who are really thinking about the judicial part of things. So the Democrats are absolutely coming together in different ways in their areas of expertise to fight back right now. And this budget reconciliation bill is, across every part of our economy. And it's also, I'm just going to say, had lots of meetings with businesses in the last few weeks. And to your point, that the business community needs to also stand up and
Yeah,
find their courage.
yeah,
Um,
they do.
when everyone's asking for their special agreements with Trump, it placates him and it plays into this idea that he's the deal maker. We just need to shut that down. He's creating chaos and disruption that's really going to harm all of us.
Absolutely.
Um, Okay, so we are at 3 minutes till, and public lands, yes, I see that too. I'm on the Natural Resources Committee, and we are fighting like crazy for our public lands. And the bill that we passed out of the committee, I say we, there was not a single Democrat who voted for it, was an atrocity. It absolutely is putting forward really deleterious things to all of our health, and the boundary waters in Minnesota is one major focus of that bill. So,
Yeah,
um,
that's devastating. Those natural treasures that once you destroy them, you can't get them back. So we've got to protect them for now and for future generations.
yep, we are all in this
Yeah,
together. I'm so grateful for folks joining. We will continue with Mondays with Maxine. I hope, Dr. Morrison, you will join me once again in the not too distant
I
future.
would be honored. Thanks so much for inviting me.
Thank you for coming. So all of you, I'll give you 2 or 1.5 minutes back so that you can look up your representative and senators if you don't already know. Please share with them your perspectives. This is an incredibly important week. This week, next week, they're trying to get the budget reconciliation package finished by the end of May. I have every reason to doubt that that will happen, but these are the times that being loud, making your voices heard is going to have impact. So please, don't go do something else. Spend some time writing a note to us or to whoever your representatives are, because we want to hear from you and understand what your perspectives are. And talk to your community, make sure people understand what's at stake, because it's going to take all of us to shut this down.
We're in this together.
Yes, we are. All right, friend, take care and all
Thank
the best
you.
to everyone watching.
Good night,
Okay,
everyone.
good night.